Cancer cervix is the second commonest cancer in the worldwide, next to carcinoma of the breast. But in India, this is the first commonest cancer among women. It is a preventable cancer. As we all know, prevention is better than cure. So, what causes the carcinoma of the cervix? It's the human papilloma virus of strain 16, 18, 31 and 32 is a causative factor for the carcinoma of the cervix. Mainly, they contract the HPV virus by sexual intercourse. So, the risk factor for the carcinoma cervix is number 1, early sex, sexual intercourse. Number 2, multiple sexual partners. Number 3, smoking. And number 4, having a HIV infection. What are the symptoms the patients are presenting with when they have the carcinoma of the cervix? Number 1, they usually come with the bleeding after sexual intercourse. Number 2, could be bleeding in between the menstruation. Number 3, sometimes menstrual irregularities. Number 4, it's a rare but bleeding after menopause. How the disease is progressed. Once they get a HPV infection, it affects the neck of the womb, that is the cervix, and start doing some changes in the cells of the cervix. We call it as precancerous cells. When we intervene at this point by screening and detecting the precancerous cells, they may not progress to cancer. But if they left untreated for about 10 to 13 years, it can change into cancer of the cervix. Next, I'm going to talk about how the disease is progressed. Once the cervix is infected with a HPV virus, it causes changes in the cells of the cervix and become precancerous. If we don't intervene at this point, it may change to cancer in 10 to 13 years. So, how it is treated? As I said earlier, prevention is better than cure. Prevention part of it comes here by having HPV vaccination, either in the teenage period or before get married or first sexual intercourse. And second is by cervical screening. In India, they have started by around 2000 having a cervical screening program to detect early precancerous cells. So they have a program which ranges from that they start the screening from age 30 to 59. So once they come to clinic at the age of 30 for the first smear, they have a look at the cervix and take a pap smear by a brush. If they could see any precancerous cells by looking at the precancerous cells, it will be treated accordingly what kind of the stage the precancerous cells are. The next step after the pap smear, that is Papa-Nicolau stain smear, is the colposcopy. What we are doing in the colposcopy is visualization of the cervix with the Lugol's iodine or visualization of the cervix with the acetic acid. By a change in colors in the cervix, we will detect the abnormal area that is going to have a precancerous cell, or they may change it to cancer cells. So that part of the change in color will be removed. So that is the treatment, or part of the cervix can be removed as a part of the treatment. After the removal of the part of the cervix, that is the infected area, those patients will be followed up with the pap smear every 6 monthly to 1 year. If in the pap smear, if the cancer of the cervix is detected, depending upon the stage of the disease, the stage means whether it's affecting only the cervix or is extended to the uterus or nearby structures, the treatment will vary. And also the treatment depends upon the age of the patient and how many children she want to have it in future. So depending upon all these factors, either cervix can be removed or uterus may be removed along with the nearby structures. Sometimes they may need radiotherapy or chemotherapy depending upon the extent of the disease.